Hey you guys, it's Amy Vanderlinden here at Moment of Truth Physical Therapy, and today we're going to talk a little bit more about my age group and why sometimes you might not have had any issues at all after having kiddos or earlier in life, and all of a sudden you find yourself in your 40s, maybe even your 50s, and you're suddenly having issues leaking. So we're going to dive into that a little bit and talk about some of the hormone changes and why that's impacting you and what you can do about it. All the way up until you have menopause and stop having a cycle. During that monthly cycle, you get releases of relaxin during your bleeding phase of the cycle, and you also get release of estrogen around ovulation, both of which can cause some ligament laxity. Also, while you're going through your cycle, your uterus changes size and position a bit. So from swelling, obviously, as it's preparing to bleed, and also tilt. So all of those things can put different pressure on the bladder, pull differently on all of the structures. There's a lot of ligaments, fascial tissue, all of those things you've probably heard me talk about. And so those can all combine to create different stressors on the body that can lead to leaking. And some of those hormonal shifts that usually kick in around age 40 can make that seem sudden, or can make that seem like you suddenly are having weakness or issues. So we want to help you feel better about your body and know how to deal with this and not be scared that you're relegated to pads, medications, or worse, even surgery. So stay tuned as we dive into 3 specific myths around this issue.